Could not start captions. Sorry, I'm sick.
Hi, Nat, this is Clary. I just turned them on, so you should be able to see. Can you see the transcripts?
Yes. No,
Okay.
not the captions.
Close. Right. Can you see those?
Yes.
Wonderful.
Wanted to sign in early so that I could make sure that it was actually working. Thank you.
Thank you.
Nat, I thought you'd be at the Roundhouse.
This is Nat. I'm having to enlarge the caption window. I have been there a lot, but today I am. Paul, you're in healthcare, correct? You are emergency medicine.
I used to be. I was a paramedic.
Okay. And there's only a few of us here.
Oh, goodness.
Yeah. It'll be okay. But I'm trying to do a lot of the work from home using video. But it's going to be anywhere from 2 to 4 weeks just to watch. Information is power.
I wish you well.
Thank you. But I am there a lot. I am watching a lot, and there's a lot going on.
Yeah. Yeah. Very busy session.
Yeah. And I'm always there anyway. So, so I'm going to mute and I'm going to step away for a sec. If you probably have some pre-meeting housekeeping you'd like to get done. And this is Natsville, and I have the agenda. Are there any changes to it?
No.
Okay, great. So I'm going to step away for a few minutes. Thank you.
Okay. Bye-bye.
Thank you. So this is being recorded now, just
Okay.
information.
This is Nat. Claire, are you doing the caption controls?
I believe on Teams anyone can do the captions, but I did turn them on.
Okay, I was trying to. Okay, I was able to change it myself. It's easier on the eyes for me to have white letters on a black background, but I was able to change it myself. Thank you. You don't need to do that for me. Sorry.
No problem. I'll leave this one as it is.
So, Carolyn, what part of Canada?
Mostly from Western Canada. So born and raised on the West Coast, and then grew up on the Canadian prairies in Alberta, and then went out to Ontario for a bit, went to university out there, and then came back to Alberta, and then immigrated to the US.
Oh, goodness.
Yeah, but I've now been here longer than I was there.
Oh, wow. Well, you still have an accent.
I know, I bite my tongue on that all the time. I'm trying to fit in.
Well, I probably drove through your communities when I went up to the Arctic.
Oh, I'm sure you did. So what were you doing up there?
We just wanted to drive to the Arctic Ocean. So
oh, cool.
We did that back in August. It was an 8,000-mile trip and took us a month. And beautiful. I mean, we basically went north to Calgary. We did all back roads, and then we went Calgary west to Dawson Creek.
Yep.
And then got the Alcan and took that all the way to Whitehorse, and then kind of headed north-ish to Dawson City. And then from there, it's a dirt road. It's called the Dempster Highway. It's a dirt road that goes all the way up to a small village called Tuktoyaktuk.
I know Tuktoyaktuk.
Ah, yeah, beautiful.
No, but I did not go to Tuck U. That's a terrible joke that everyone tells. Yes.
Yeah. but very
Well, that
friendly,
is
very beautiful, very welcoming. It wasn't very touristy, but we got to camp on the shore of the Arctic Ocean right there in Tug.
how
Uh,
fabulous. Wow, what a trip.
yeah,
And
yeah.
so
Once in a
Calgary
while.
is my stomping ground.
Oh, okay. Yeah,
Yeah.
big town, big town.
Yeah. Well, it wasn't when I started out there. Yeah. But yeah, that's where all the geophysicists are, it's the white collar of the oil patch, and then Edmonton's the blue collar.
Oh, okay. Yeah, we did.
That and
We
that
went the outskirts of Edmonton because we were going to go through Banff and Jasper, but they were
yes,
still closed when we were going up because of the fire.
yeah.
Uh, and they opened it as we were coming back down, so we got to drive through it, but we couldn't stop. They're like, you can
Mm.
drive through, but you can't stop. So we got to see, we got to see the Glacier Parkway and all the
Yes.
beautiful scenery. Yeah.
Oh, I'm so glad you went.
Yeah.
Hi, Stephanie. Yeah, I made the annual pilgrimage probably 25 years going from, I used to live in El Paso, Texas, going from El Paso up to Calgary and Vancouver area annually with my kids.
Very nice.
Yeah. Nate, you've got your hand up.
This is Nat. Is there a Nathan or Nate
I'm
in the
sorry.
room? This is Nat. Was I being called on?
Yes, you've got your
Oh,
hand up.
thank you. Yeah.
Clary,
I'm trying to lower, this is Nat, I'm trying to lower my hand. Um, uh, our chair, Mr. Chair, members of the committee. Um, will we be doing our best to state our names before speaking? What I'd like to be able to do is enlarge the captioning and then be able to, it's hard to remember the initials. And if I enlarge the captioning, sometimes I'm not sure who's speaking, and it really helps to have the person say their name. If that's too uncomfortable for people, if someone can send me the transcript, I'll try to get better with the many people's initials or their acronym name. Thank you.
we'll certainly do that. Thank you.
This
So
is Nat. Thank you.
Yeah, Nat, this is Paul. My plan is to make sure and mention that. I have it in my notes that when we start the meeting, which is in about four minutes, we'll make sure and remind everybody.
That was Nat doing Happy New Year in sign language.
Happy New Year to you too, Nat.
This is Nat. I just saw in the caption it said not doing Happy New Year in sign language. Oh well, captioning translated my yes to a no. I'll try again. Happy New Year! Yay! Confetti. Champagne. Mr. Chair, this is Nat.
Go ahead, Nat. This is Paul.
There are a lot of mentions in the House Bill 4 on competency. Many mentions at risk of harming someone else or harming themselves. The bill's been dropped. It's being heard next week. There was kind of a primer on the concepts yesterday from the justices and staff. So that's a very large part of this. But there's some significant gaps on availability of counsel, because you're going to, a person would need to be represented, but there's not a mechanism in place for people to have no cost, low cost representation. We'll dive into it, but I'll be happy to join any meetings later that are part of the legislation and policy work group. Thank you.
Thanks for that, Nat. This is Paul. We will have an update if Wendy and or Corey log on to the meeting, but also a reminder, we do have our legislative advocacy day, and we'll give you details on that in the meeting here upcoming.
This is Carol, and I'm just going to give everyone one more minute. We've got people pouring in, so that's great. All right. Well, we will get started. Just to let you know that this is being recorded. Welcome, New Mexico Suicide Prevention Coalition members and supporters, to our January 24th, 2025 quarterly meeting. I'm Carolyn Moore, Suicide Prevention Coordinator at the New Mexico Department of Health. I appreciate all of you for being here and for your dedication to preventing suicide in New Mexico. So right now, I'd like to take a moment to thank Liza Suzanne in advance for being our scribe, Paul Bierce and Kate Reeves for chairing our coalition, and working with our work group facilitators, Dylan Pell, our Department of Health, Mental Health Epidemiologist, for his upcoming presentation. And finally, I would like to thank Clary Miller for sharing her knowledge with me. When I grow up, I want to be Clary. So I've got a couple of housekeeping items. So as I said before, the meeting will be recorded and they will be available for viewing on the nmspc.org website and on YouTube at nmhealth.org. If you have any, if you'd like to mute yourself, please, while we're starting up. If you have any event flyers that you would like to have uploaded on the coalition website, please send them to me at carolyn.moore at doh.nm.gov, and I'll get them up on the website. I will also be updating the quarterly meeting Teams invite. So you're going to be seeing a delete meeting invitation from Clary, and then you'll see a new meeting invitation from me. So please be on the lookout for that email. We are always looking for new members and better ways to help reduce suicide, and we can only do that heavy lift with a lot of hands. So please spread the word about joining the coalition. Thank you. And finally, our quarterly meeting dates are on the 4th Friday of the month, and they are April 25th, July 25th, and October 24th. Please let me know if you have any suggestions for topics or presentations that you would like to see covered in future meetings. So with that, I would like to invite Paul to remind us about self-care. And then Paul, the floor is yours. Thanks so much.
Thanks very much, Carolyn. This is Paul. I would like to do a couple of housekeeping items as well. First off, thanks very much for showing up today. This is huge. We've got 55 people logged on right now. That's just absolutely awesome. We've got an amazing agenda today, as you'll hear in just a few minutes. I also want to thank Carolyn for all of her support, and I agree that we all want to be Clary when we grow up, because she is an amazing person, and we appreciate everything that both of you do for us, because we wouldn't be able to do it without you. So just the kind of trauma-informed message that we want to start the meeting with. Just remember that this is a tough subject that we're covering, and I always say that we're going to be talking about some things that could be a catalyst for bringing up some feelings. We've all had experiences, and either personally or friends and colleagues or family members, and it's important to take care of yourself. So if something comes up that is uncomfortable and brings up some feelings, please take time for yourself. Step away, go do some breathing exercises, do some good self-care. If you need to take a walk, nobody will certainly judge you for that, because self-care is ultimately super important. So please take care of yourself, either during this meeting and from here on out. So thanks very much again for being here. I would also like to mention that for accessibility for this meeting, it is being recorded and there is closed captioning initiated. Please, if you could remember to state your name when you speak, because then that shows up on the closed captioning for folks who are hearing impaired or have some disabilities with the voice. And so please, if you would, just do a quick state your name when you were speaking. And if you're for Dylan, I know he's very, very good about this. Dylan is amazing, by the way. But if when he's doing the presentation, if he's bringing up some slides that have visuals, do a quick just a description of what the visuals are. So with that, I would like to kind of just go over the agenda for today. And again, it's pretty full, so hopefully we'll get through this in our allotted time. We're going to, like I said, have Dylan Pell from the Department of Health is an epidemiologist, and he's going to talk about the recent data that has come in. We're going to go over some coalition business. Carolyn, myself, Clary, and Kate will kind of update you on some of the things that are going to go on. And then hopefully I see just looking through the group, it looks like we have at least 4 of the work groups represented. If there's more, I'll kind of try and find those out. We're going to do quick work group updates, and then we'll have time at the end for announcements, trainings, updates of any type. So with that, Carolyn, I'll turn it back over to you to introduce Dylan.
That's great, Paul. Thank you. I want to make sure Dylan's on. I know that he said he was going to be a couple of minutes late. Are you here?
I'm here. Hope you can hear me okay.
So Dylan Pell is our Department of Health, mental health epidemiologist, and I will let you take the floor, Dylan. Thanks so much.
Thank you both, and thank you everyone for everything you do. My name's Dylan Pell. My title is mental health epidemiologist, and I work at the New Mexico Department of Health. I'm going to click enter to put my name and email in the chat. People are welcome to reach out with questions, follow up, or requests for data if they are looking for it. And then before I share my slides, I guess I'll just talk a little bit about what I do and how you all have a role in that also. So I look at large population data sets of New Mexicans to understand health outcomes and describe them in hopes they can help us better plan and think about our community. I'm going to show you a lot of slides that will show trends and relationships, but the one thing I'm really not an expert on is why these things happen. I might know that there's a connection between a certain race, ethnicity, and a suicide outcome, but I don't know what might explain it. So the reason I say this is because I think part of the epidemiological process is listening to community experts who really know what's happening and have eyes on the ground. So we're going to share some what I found to be pretty surprising news about suicide data this year. And I really, if we can find a way to have a few minutes of discussion from people about their own insights about why these things might look a certain way in the most recent year, I genuinely would appreciate your feedback and insights. And I think the best answers I can give other people about why these things might be happening would come from listening to people who are doing the work. So I'll share slides, but I don't want to present myself as the expert on everything. I'm just telling you what the numbers are, but I really think you all have so much to offer in terms of interpretation of these results. So let me share screen. Oh my gosh, I have too many windows open. And I won't be able to follow the chat, so please just interrupt me while I'm talking if there's a question or an issue that I need to address. Before I go on, can someone just let me know if they can hear me okay and if the slides are showing correctly? Okay, I see a thumbs up. Thank you so much. Okay, so just to echo what Paul shared earlier, I might be talking about suicide and mental health. I won't be talking about individual stories necessarily, but I think seeing the numbers of how many people have died or been impacted by these issues can affect a lot of us. I know many of the people on this call that we've been affected by suicide directly or indirectly. Do whatever you need to do. If that's stepping away and coming back later, that's totally okay. I would ask that if I talk about this topic in a way that you find offensive or you just feel like it could have been said better, please let me know. I don't want to reproduce harmful comments in future presentations, and I won't know unless people tell me what I'm doing. But I really want to share this information in the most respectful way. But there's a note here about 988, and I think my next slide is also an echo about 988. I bet most people here, hopefully everybody knows what 988 is, 3-digit number to call, chat, or text to talk to somebody about emotional, mental, or substance use issues. That's for us also. It's not just for the people we support. And I know that, in some ways, when we do public health work and prevention, us supporting each other directly is, I think, one of the most immediate and tangible ways we can do stuff. So I'm a person who didn't get mental health help until I was in my 30s. And I regret doing that. I wish I had done it, honestly, when I was a teenager, but I didn't have the support and direction to do that. So I would encourage other people if it's worth it. It helps, and it mattered to me at least. Oh, I see. Sorry about that, Nat. So yeah, I'm showing a slide that just has an infographic of 988 and shows the ways that you can connect to 988 right now. On this slide, I'm showing some information about where the data comes from. So we get our data from public health surveys, which are scientific studies that NMDOH, and sometimes we'll share information from the Substance Abuse and Mental Health Service Administration from their National Survey on Drug Use and Health. NMDOH conducts 3 surveys. I'll be sharing data from 2 of them. One is our Youth Risk and Resiliency Survey. We survey middle school and public high school students in New Mexico every other year. We also have a behavioral risk factor surveillance system. We call several thousand New Mexico adults each year and ask them about health outcomes and have a few questions related to mental health and suicide in that survey. When you see suicide statistics, these are really generally produced from death certificate data. So when Office of Medical Investigator or someone else issues a death certificate, those end up creating data sets where we were able to calculate how many people died from different causes. I'll also be sharing a couple slides that just give examples of how we can use emergency room visit data to understand trends in mental health or suicide-related emergencies. Okay. So the first few slides in this presentation are going to be I think I'm trying not to bury the lead anymore. These are going to be kind of like what we learned about the most recent data in 2023. So right now it's 2025. So I kind of will invite you all to travel back in time a year and a half ago. It does take us about 10 months to analyze and prepare data sets, and the death data is created not just by NMDOH, but from the National Center for Health Statistics, NCHS, at CDC, which is why it often takes that long to get reliable information. But there's a lot of steps in validating our data. So broadly, in 2023, New Mexico had the 5th highest rate of suicide in the United States. I listed the states that were behind, which was Alaska, Montana, Wyoming, and Idaho. I think I might mention this on a later slide. In most previous presentations, if you've come to these before, New Mexico had the 4th highest rate of suicide. We've moved down 1 spot on the ranking list. I know there's often a lot of discussion too about these states may have some similarities, particularly the mountain states and states with low populations and large landmass. New Mexico in 2023 did have a higher suicide rate than the U.S. It was 62% higher than the U.S. rate. And then I get sort of jarred when I compare our state to the states with the lowest rates. States like New Jersey, New York, and Massachusetts were about 3 times higher rate of suicide death than occurs in those states. While this bothers me, I also sort of see it as hope that that risk for suicide can change in different places, and that we should maybe be striving at least to be among the lowest states in the future. So we had 470 deaths in 2023 to suicide, which was an average of 9 deaths per week. In 2023, males were the overwhelming majority of deaths in New Mexico. Their suicide death rate was 6 times higher than for women. And then there were higher rates among white and American Indian residents, younger adults, and older adults. And then consistent with previous years of data, about 60% of our suicide deaths in New Mexico included a firearm as the mechanism of death. And I guess please put comments in the chat. We're a little bit bigger group. I might try and break the presentation to just do a check-in and get some feedback. But any notes or questions in the chat is helpful for us to come back and visit if you have them. So how does this compare to 2022? Some of you may have seen there was a press release, I think it went out last week or maybe the week before. Time is folding in on itself for me, and I'm losing track of time, so sorry if it's longer than that. But New Mexico's suicide rate significantly dropped from 2022 to 2023. It was about 9% lower in 2023 than it was in 2022. And there were some really substantial differences in who died from suicide than in previous years. So I kind of have it in the third bullet, but the number of men who died in 2022 versus 2023 was basically the exact same. However, there was an over 40% drop in suicide deaths among women in 2023. There was also an over 40% reduction in suicide deaths among American Indian Alaska Native persons. And there were fewer deaths among Asian, Pacific Islander, and Black or African American residents. I note the difference isn't statistically significant. It may have been if we had had more of those residents in New Mexico. We deal with some smaller numbers with those groups due to the demographics of the state. While those groups decreased, there was a significant increase specifically among Hispanic males in the number of suicide deaths and the rate. And it was specific to Hispanic males. We saw a similar decrease in Hispanic females as the overall female suicide death decrease. And so this is kind of a lot to take in, but I guess to kind of put it in your head, when you add up a bunch of like large drops and large increases and decreases, they can average out to like a 9% overall decrease. But the story seems to be that there was really major demographic changes in what suicide looked like in 2023. One thing in epidemiology is we avoid sort of overly reading into a single year of data. We usually want 3 points in a row or 3 years in a row of a consistent pattern before we call it a trend. So it could be something specific about 2023 and may not tell the story of what we'll see in 2024 or what's going on in our community now. But this is definitely something to watch and may affect how we talk about suicide in communities. It's also something that isn't necessarily found in national data. So nationally, suicide did not decrease 9%. We were ahead of the country in the decrease. And there wasn't this large decrease in suicide death among women at the national level. There was a meaningful decrease in suicide death among American Indian Alaska Native persons nationally, but it wasn't as large as the New Mexico drop, and our decrease is a big part of the national drop. I'll disclose that when I first saw this data, I tried to do a lot of checking to fact check it. I pretty much asked all my colleagues who work on this to also rerun the data. I reached out to the Office of Vital Records to see if they could run checks, and they looked at the underlying data system. If people have been to these meetings in previous years, suicide's actually been pretty consistent in statistics in terms of who's dying and what the patterns have been. So this was a very unusual year, but with some good news with an overall decrease that we hope to see continue. Yeah, so I put a note here about how it looks in the United States. Overall, in the US, suicide declined only 0.6%. No significant decrease among women, and the decrease among American Indian Alaska Native persons was 11.2%. I see a note about slides being shared, and I shared them with Carolyn. I shared them in the raw PowerPoint format. I often try to PDF them, but I do hope we can send out the slides. You all should use this information if you can. So I made some graphics to try and show how this looks on line charts to kind of make it easier to see what we're talking about. So this is a line chart showing the rate of suicide death among New Mexicans from 1999 to 2023. Overall, in the last 24 years, the rate of suicide increased 23%. That includes the 9% reduction in the most recent year. But if you look at the chart, you can see that for really the last 5 years, 2018 to 2022, we had a flat suicide rate in New Mexico. And then in the years before that, it's generally been increasing year over year. There have been years when there have been dips, and they were single-year dips. So that may be what we're seeing in 2023, but it could also be the beginning of a trend. I wanted to break this down in terms of the topics I highlighted so you can see really how significant some of these drops were. So this is a chart of suicide deaths among females in New Mexico. What's sort of worth pointing out here is not only was there a 40% decrease in suicide death among women in New Mexico, this was the lowest count and rate of deaths in about 18 years in New Mexico. And then if we look at American Indian or Alaska Native persons, while their rate still remains higher than some other race ethnicity groups, it's not as much as it was before. This line chart shows that this is the lowest rate of American Indian Alaska Native suicide death since 2017, after years of continuous increases. This is particularly hopeful because the American Indian Alaska Native suicide death rate had been increasing at a greater pace than other suicide death rates for other race ethnicity groups. And again, it's a single year of data, so I'm not positive if we'll see this continue next year. But I'm really hopeful, and I do hope it represents a lot of the good community work and the way communities are thinking about these topics. So I mentioned the Hispanic male suicide death increased in 2023. This is also noteworthy. This was the highest rate of Hispanic male suicide death in any year of data going back to 1999. I don't have an easy or convenient way to pull rates before 1999, so this may be the highest rate that we have, but it was the highest that I was able to analyze for this presentation. And I also think that while the other news is hopeful, that this is a topic that should really deserve some close attention and consideration about, is there something going on, specifically about Hispanic men and their risk for suicide, and why would their story be different than other men or people in the state? Okay. So I'm going to stop there. I know that there's a busy agenda, and we may not get through every slide I'm having to share. But if we could spend just a few minutes checking in, I would be really interested to hear feedback if anyone's willing to raise their hand and share about, when you see this information, how you're interpreting it, what questions have come up immediately. And we'll have time at the end to talk more, but I just think it's maybe fresh in our minds. And it's also nice to break up all these data slides with some discussion. So if anyone's feeling bold, I know we have a big group, and just a response or a thought about why this might be happening, I'm genuinely interested. Any brave souls out there? Yeah, go ahead. I see your hand raised, Nat.
This is Nat. I'll be brave. Something hard but beautiful happened a couple of weeks ago. There was an elderly woman who was on hospice. They were very agitated about quite a few things. They created a Facebook post that said, "I didn't know it would be so hard to kill myself." I reached out to 988. I reached out to get some help. But even before that could occur, Facebook reported that the person was trying to end their life, and first responders got there and got her to the hospital. And it's a network that can work. And I found that a very encouraging partnership on platforms that can sometimes be very difficult, but can also be very helpful. Thank you. This is Nat signing off.
Thank you so much. Go ahead, Liza.
Good morning, everyone. This is Liza Suzanne with the Department of Health. Dylan, did you do any looking at what women died of if they did not die by suicide?
That is, the answer is firmly no, but that's a really good question. We should look at the overall leading causes of death changes for women in 2023. I'll say the only things related to what your question is I did talk to our overdose mortality epidemiologist a bit about these trends. And in particular, one thing we're seeing in overdose mortality is a smaller number of overdose deaths that are being attributed to intentional self-harm or suicide, and more that are either unknown or unintentional. And I have a question if some of these fentanyl deaths may be intentional deaths or deaths we would consider suicide, but they're maybe because of the volume of deaths, they're being less carefully examined or assigned to suicide. That's purely conjecture. I don't know if that's true, but that's the only thought I've had related to that. I think that's a really good suggestion, though. We should do that.
Great. Thanks, Dylan.
Dylan, this is Carolyn. We've got a question in the chat from Richard Bell. Will this presentation include suicide rates for the LGBTQ plus community?
We definitely have a lot of data on suicide-related behaviors in our YRRS, which is our youth survey, and our BERFIS survey. I won't be showing suicide death rates by gender identity or sexual orientation, and that's because they're not collected on death certificates, so we aren't able to produce estimates on that basis. That's actually a real reason why survey data are particularly important. Is the best way to identify someone's sexual orientation and gender identity is to ask them how they prefer to be identified. In many cases, we can't get that information from a deceased person or their loved ones, although much more work could be done on that issue. So I won't be showing death rates. I can't remember if I have a slide in here on it, but we have really good data about those risks. And if there isn't a slide, what I'll say is that youth who are transgender and non-binary are 2 to 3 times higher risk for most of our suicide-related measures. That's attempting suicide, considering suicide, being injured in a suicide attempt, than cisgender students. And we also see similar high rates among students of suicide attempts for students who are lesbian, gay, or bisexual. But I hopefully included a chart that I can share on that. And if not, please email me. We actually put together a table reference book that was about health topics related to that community that I'm happy to share with people who want to learn more about that. I can return, but if there's anything I missed, just raise your hand, speak now. I see Paul, I saw you unmute. You got something?
Yeah, Dylan, this is Paul. I was just going to let you know, please don't worry about the time. We'll make it up in the end if we need to. But this information is incredibly important and really helps paint a picture of where we're at in the state. So please don't worry about having to rush through your presentation.
Okay, I'll try it. Part of it, I just don't think it's like ethical to make people look at data slides for more than an hour. It's hard. I think our brains aren't really made for that. So, I mean, I have to look at it all day, but that doesn't mean you all do. So anyways, I'm gonna go back and then we'll do another check-in. Oh, I see. So I see a question about our from Veterans Upward Bound, Kelly Fitzpatrick. Are there any plans to find out what those 3 states with the low suicide rates are doing to obtain those results and how they compare with the measures New Mexico is taking? I don't know if our prevention teams have. There are some states that receive CDC funding, and obviously most states work on public health response. We have ways to ask questions to find out what's going on in other states. There are geographical differences, like these are high population concentration areas. And so some of that might be a factor, but I think that's a pretty reasonable question. I'm going to maybe save that for the end, unless Carolyn or Clarie, I don't know if you all have investigated states with lower rates and have an answer off the top of your head.
I have a spreadsheet that I'm going to try to put in the chat at afsp.org. You can look at every state's current legislation and it has their rate. So I put it in a spreadsheet and I'll put that in the chat.
I have seen the spreadsheet and it's awesome. I think that would be a good starting place. Okay, I'm gonna go back to the slides and then we'll make sure to check in some more. I think it's really important. So I want to just highlight some other from just early analysis of this data to try and highlight some things that I thought were noteworthy, that also were different about 2023 than 2022. People always ask about youth suicide rates. And so from 2022 to 2023, the number of kids who died of suicide, and when I say children, that's like youth age 0 to 17. And I'm showing a line chart here that's just showing an adjusted, actually these are crude rates of deaths among kids. It increased from 12 deaths to 17 deaths, or a rate of 2.5 to 3.6. The thing I would say about this slide is that the 2023 rate of youth suicide death is lower than it was in the years of 2017 and 2020. And because the number of child deaths is lower than adults, 95% of suicide deaths are among adults. I tend to want to interpret this, like if I put confidence intervals on here, I would say there's no significant difference between 22 and 23. And if a later slide, I'll show you some rolling years where I put multiple years together. I think that this may be a trend that, at least in the last 3 years, that they look like the general trend is lower than it was in the preceding 4, and that they're a bit closer to what they used to be 10, 15 years ago. But we could be wrong. It could be that in 2024, we see this number continue to go up. But this is sort of a mixed story. So there's a higher number than it was in 22, but it's still lower than it was a few years ago, if that makes sense. However, we're seeing demographic changes by age also in 23 data. So when looking at groups who are among the highest risk for suicide death, people who are aged 18 to 24 were actually among one of the higher risk groups in New Mexico in 2023, which was a little unusual. They're not usually flagged as among the highest risk for suicide, but they had something, I don't know if I marked it on there, but it's like about 20-25% increase in suicide death among these young adults. And I was talking to Clary a little bit about this yesterday, but I think it's also really maybe brings questions about sort of like school age prevention, suicide prevention, and recognizing that the years when youth transition from school age to early adulthood may be really important times for risk for suicide, and thinking about what it means to both prepare children and teens for adulthood, around their emotional health and suicide prevention, and also how we can engage these really younger adults. I know there are good programs at universities. I think I'll show a slide later that does look at occupation and education-based suicide death. Adults who didn't finish high school or who didn't finish or enter college are at much greater risk of suicide than those who did. And so thinking about how we can engage those adults who don't enter the college environment may be really important as well. Okay. And then just another really dramatic change is we saw a pretty substantial decrease in what was a higher risk group, adults aged 45 to 54, with their suicide death rate dropping from 35.8 to 20. Okay, so I'm gonna move into some sort of like contextual data information that talks about information that might give us hints or ideas or show deeper relationships. So I did want to talk about sort of mental health more broadly and about categories of death that may be related to each other. So what I'm showing on this chart is the 10 leading causes of death in New Mexico in 2022, and how the rate of these deaths has changed over time. So if there's an orange bar on the left of the center line, what it's indicating is that New Mexicans are less likely to die in 2022 of that cause than they were in 1999. So for the very first bar, where it says heart disease, that's saying the rate of people who died from heart disease in 2022 is now 28% lower than it was in 1999. The thing that I want to highlight here is that there's a few causes of death that have really increased in the last 23 years. That's unintentional injuries, which used to be largely car accidents, but that now includes drug overdose deaths, which are a large portion of those deaths. It also includes some like alcohol poisoning deaths. Chronic liver and cirrhosis deaths, which some of those deaths are associated with alcohol as well. Alzheimer's disease, which it's not something that we presently do a lot of work on in MDOH, but I consider related to mental health and suicide deaths. These are the only causes that have really increased in the last 23 years. And I say this because I think in public health at large, really thinking about behavioral health, connections to mental health, is going to continue to be more and more of a major conversation as we think as a state about how to reduce preventable deaths and how to understand issues. I also think that it can be easy to sometimes silo these things where some people work on drug prevention, drug overdose prevention, or they work on suicide, or they work on mental health. But there's a lot of evidence that these are closely connected and that people who are at risk for one are often at risk for the other. And so just thinking about how we can better coordinate and plan public health responses for these shared behavioral health linked causes of death is something I've been thinking about. So someone, I see that Nat asked a question about unintentional injuries from firearms. There are unintentional injury deaths from firearms that would be included in that bar. Last time I checked, they weren't a large proportion of those deaths, but there are absolutely unintentional injuries. There's also falls and other forms of injuries that fall into that bar. I've kind of wondered if they should consider breaking that into at least a couple of groups, especially as now drug overdose that represents such a large fraction of them. It's a little harder to interpret what is in that third leading cause of death. This is my favorite chart to talk to people about, especially thinking about suicide prevention. This is a bar or a line chart that has 2 lines on it, and these are rolling years, which means I put 5 years of data together, one at a time, so that we can get more stable trend lines, more readable graphs. And this is for kids age 11 to 17, looking at 2 leading causes of death. So the green bar, the green line is showing motor vehicle and traffic deaths, and the yellow line is showing suicide deaths. And the thing that I want to get across here is that prevention can work. So in 1999 to 2003, motor vehicle and traffic deaths were absolutely among the leading causes of death for young people, and by far. What this line charts that in New Mexico, and it's true nationally as well, that we've substantially reduced the number of deaths due to motor vehicle and traffic accidents, or crashes, I should say, among young people in the last 25 years. It's down about 60%. And it didn't happen all at once in a single year either. It was a lot of small changes year over year that led to this. I often sort of encourage groups to sort of put in the chat the variety of things that they think might have led to this. And it is a lot of things. It's attitudes about drinking and driving, attitudes about safe driving. It's how cars are built safer. It's how pedestrian walkways and pedestrian easements and the roads are built. It's about how laws have changed and education has changed. But we see that when you sum all these things up and you do them year over year, that it can really make a difference in a leading cause of death. The yellow line is suicide death among young people, ages 11 to 17, which this chart hasn't included 2023 data yet. It could, I just didn't have the opportunity to update it yet, and I will. I think it'll add, so one more dot, they'll probably be at a similar spot, is my guess. But that suicides increased about 47% among young people in the last 24 years. When you include all unintentional injury deaths, it's suicide and unintentional injury deaths are sometimes trading places for young people. Some years suicide is higher, and some years unintentional injury deaths are higher, but they're really about the same count right now. And suicide is really among the leading cause of death for young people today. That's largely because most young people aren't dying. Most young people do survive into adulthood, especially teenagers. And that we've seen reduces in other causes of death like cancer among teenagers as well. I saw a question in the see some questions about intentional injuries from firearms. We have good data on that. I may not have put more slides in here, but we can definitely share more information about unintentional injuries from firearms. I see a question about Alzheimer's deaths from Carrie. And I'm not actually an Alzheimer's death expert, so I don't know the answer to that, but someone in this community might have a good answer for that. Encourage you to answer in the chat if you do. So I talked about this a little earlier. I'm showing a bar chart that shows risk for death based on highest education attained. So I mentioned we don't have sexual orientation or gender identity death certificates, but we do record a person's highest education achieved and also their occupation on death certificates. And that information really seems to relate to risk for mortality and suicide. This chart isn't specific to suicide. It's showing drug overdose, suicide, and alcohol-related causes of death together. The thing I just want to highlight is that adults who finished a bachelor's degree were 78% less likely to have died due to drug overdose, suicide, or an alcohol-related cause than adults who did not finish high school or get a GED. I've looked at this for suicides set by itself, and it's a similar pattern and story. And I just think that when we talk about legislature and policy, thinking about how we can help more adults finish school, achieve these economic outcomes. It really seems closely related to some of our mortality outcomes. It may be part of the story about why our state looks different than other states as well in terms of risk for these mortality outcomes. The next slide is going to show, again, drug overdose, alcohol, and suicide deaths, but broken down by their risk by occupation. This is actually a good example of work I started doing because of this meeting that we're having right now. I don't know if this person's here, but I remember a person who worked in construction and was an advocate for suicide prevention had first talked to me about how the rates of suicide were so high among construction and extraction occupations, which in the first year or two of me working here, I really didn't recognize that these disparities were so great. He knew about it because he had lost people he cared about, but it's absolutely visible in data. And there's been a lot of writing nationally on this topic, though I think sometimes it's handled more by people who work in occupational health than traditional suicide preventionists. People who work in construction and extraction in Mexico were 15 times as likely to die of a drug overdose, alcohol-induced cause, or suicide as people who work in education, training, and library occupations. I think there's an enormous opportunity. We see these consistent disparities among men and women for suicide death, and thinking about not just what it means to be men and women, but which jobs are closely associated with these genders. And thinking also about, say, like regions of the state where there are higher prevalence of suicide death and what occupations are more common in those areas may give us some ideas. And there's maybe real opportunity to do occupational health work, to work with these employers to provide more preventative and health services and information. I've now done I think 2 or 3 presentations to specific construction firms that requested suicide prevention information. They seem to often know about this issue, which is not surprising because these rates are so high. 440 per 100,000 people is very high. That's a really high rate of death. So just again, showing some more examples of how we can use data. I want to highlight that we do collect emergency room visit. We can also see if people were admitted, which is really indicates a hospitalization from the ED in their records. Suicide attempts among young people there were 776 of these events in 2023 and almost 4,000 suicide ideation visits. in 2023. This was more common diagnosis for young people in emergency rooms than depression or anxiety. So suicide-related ED visits are common among adolescents. Looking at adults, we see suicide ideation is happening often as well, with over 14,000 visits in the emergency room in our data system. Our data system does not include federal reporting sources like IHS or Veterans Affairs, so this is an undercount. But mental health issues represent about 6% of all emergency room visits, typically. So like 1 in every 19 visits at the emergency room has a mental health diagnosis. I want to talk a little bit about some of our youth mental health data, and just, I think this is something that when the first time I shared this slide, this was maybe more of a new topic as we were entering the pandemic and thinking about youth mental health and how school policies might be affecting it. There have been several reports by the Surgeon General about mental health related topics that are really excellent. There was one on the youth mental health crisis a couple of years ago. Last year, there was a report on the relationship of social media and youth mental health. And this year, or a few months ago, there was a report about the mental health of parents and how the challenges of parenting children and the mental health needs of parents is a significant mental health topic. Well, I'm going to share some data showing that we're also seeing decreases in our behavioral measures of young people and mental health concerns, but they still remain much higher than they were 10, 20 years ago. And so our data does seem to indicate that mental health is a major public health issue continuing to today, though we are starting to see some really positive signs of change. So I used to present, I've probably showed a chart like this a million times, but this year has been interesting because until this year, kind of like our suicide data, I was showing that for about 10 years in New Mexico, this says Southeast region. I keep trying to change this, but it's New Mexico. It's not the Southeast region. This is a line chart showing the prevalence of youth who were persistently sad or hopeless. That for about 10 years, it was about 1 in 3 students reported feeling sad or hopeless for 2 weeks or more, and that they stopped doing activities of daily life. But then from 2013 to 2021, this increased about 40%. And year over year, we just kept seeing it go up and up and up until 2021. In 2023, we had a 1-year decrease proportionally of 16%, which was statistically significant, which we weren't expecting. And this was also present nationally, although our decrease, I think, was actually a little bit greater than it was national. And so we're seeing in our 2023 survey data that among youth specifically, that their mental health measures are also decreasing. I don't know if I have a slide on suicide trend lines, but among young people in 2023, the prevalence of high school students who attempted suicide was the lowest that we've ever seen. And since we surveyed, which the first survey was in 1999, though I think the first time I asked about suicide attempts was like 2009, so I should back that up a little bit. But of available data, it dropped about 15% for suicide attempts among teenagers in our behavior data as well. Looking at the clock, so I'm gonna move through some of this a little bit quicker, but hopefully we can still check in. I just want to note that we have new measures in our data. We started asking young people about symptoms of anxiety and depression, and can now estimate the number of young people who likely have anxiety or depression based on the PHQ-2 or GAD-2. In New Mexico, that was about 1 in 4 students in high school who had either depression or anxiety, and about 1 in 5 or 6 who had both, likely had symptoms of depression and anxiety. There was a question earlier if we were going to share information about LGBTQ communities. I don't know if I'll have a suicide chart like this, but most of our mental health measures are showing that adolescent girls are at higher risk of most of our mental health symptoms. The transgender, non-binary, other gender students are at higher risk than cisgender students, in this case twice as likely to have symptoms of anxiety. And the students who identify as lesbian, gay, or bisexual or questioning were about twice as likely as students who were not to have symptoms of anxiety. This is an interesting slide. This is again looking at emergency room data. I've shared the slide a couple times for a couple of years now. What I want to point out here is that in the first week of August, the count of adolescent girl suicide-related visits doubled. This is noteworthy because the first week of August is in that year is when school started. And the part I wanted to highlight for this presentation is we now have a new year of data. So if we look at 2024, it's the same thing. We see that the first weeks of August, that the rate of suicide-related visits among teenage girls, or actually this is kids 5 to 17, that they're doubling during those first weeks of school. We see these increases when the kids return from school after the winter break, and that these just times when kids are returning to school settings seem to be associated with increases in risk for mental health emergencies and suicide-related visits, particularly among girls. Okay, so I'm going to show just a couple more, and then I'm going to check in, and then we can decide if we want to keep going, but I'll give you information on how to reach out and get more data, and you'll be getting all the slides, so you'll get the information one way or the other. I just like to talk about non-suicidal self-harm. It's related to suicide-related behaviors. The majority of kids who do some self-harm, that means like cutting or burning themselves, but not intending to die, did not attempt suicide. So 2 out of 3 kids who did some form of non-suicidal self-harm did not attempt suicide. So we don't think that kids who are doing self-harm are necessarily suicidal, but it does represent a significant risk factor for increased risk of suicide attempts. The students who did engage in self-harm were about 14 times as likely to attempt suicide as the students who did not. So when I look at this, I just think about, there really might be benefit in asking the question or talking to a student who discloses self-harm, not assuming that they are considering suicide, but knowing that they might be at greater risk of attempting than other students. Okay, so I know you're giving me permission to keep going, but I want to just do a check-in and maybe see what questions you all have that we didn't cover now, because we may have some good slides on that, and we could go and share that, if that's okay. So just to do a little pause and check in with you all. And this time my question for you is, what questions do you have about our data that you haven't seen yet?
So
I guess-
Dylan, this
Go.
is Carolyn. In the chat, Kelly Fitzpatrick has asked, looking at the dates of increase in suicide for young people, could it be related to the increase in social media use and potential cyberbullying?
Yes, it could be. And I'm gonna I don't know, close your eyes for a second because I'm gonna skip through some slides until we get to my social media one, because we do have something about that. Because there's only 2 slides in. So for the first year, we asked kids specifically about social media use in 2023, though we only asked a single question asking how frequently they used it. High school students who reported no social media use were less likely to have symptoms of depression or anxiety. And those students who reported higher frequencies were at higher risk of mental health issues. I don't have the suicide-related measures on here, but we do have some. I don't believe the risk of being injured in a suicide attempt was higher among the kids who use social media more, but we did see greater risk for kids who use social media more frequently among kids, or we saw greater risk for kids attempting suicide or considering suicide if they had higher frequency of social media use. New Mexico Department of Health is actually sort of negotiating with the New Mexico Department of Justice right now to try and fund a representative survey of adolescent social media use and their wellness. The New Mexico Department of Justice is suing Meta and Instagram because they believe that those platforms are causing mental health harms to young people, and are interested in better producing more detailed data on this. So it's possible in a year we'll have really interesting results about how New Mexican kids are being affected by social media, assuming people can figure out how to do all the contracting that needs to be done for that. So to be determined. So what else do we have in
Kelly
here?
Fitzpatrick has your hand up.
Go ahead.
Sorry, I Do you have any data on the ratio of suicides based upon location within the state? For example, per capita in small towns, in rural areas, tribal communities, as opposed to metropolitan areas? Do you have that data?
That data is available. I don't have it in the slides, but I actually was thinking about this morning that it should have been in here. We typically produce it by county, New Mexico Health Region, and we also have breakdowns by rural, urban, and metro county as NMDOH defines them. So if someone wants to send a request, I'd be happy to like produce tables or results so you can see county and those other levels. If you want township or other area, those sometimes may be possible, but they're probably still a little more work to produce. And I have to remind myself how the residency fields are entered into death data. But if it really matters for like funding or supporting communities, we can try and figure out how to help you with that.
Nat had another question about, do you have a breakdown within healthcare support occupations and healthcare practitioners by field of practice?
I don't have it on hand, but it is so there's something like 112 categories that the National Institute of Occupational Safety and Health at NIOSH, I think they call it, that they break them down by. So we can produce, like, if there's that single category of healthcare practitioners, I can break it down into all the groups that fall in them. When groups get small, it can be harder to interpret. So if there aren't that many veterinarians, for instance, like someone once asked me about suicide rates among veterinarians, I think some national data has shown veterinarians are at higher risk of suicide. I remember looking at that, but the only challenge I had is because there's not, maybe there's 100 veterinarians in New Mexico. And so if there's one death every few years, it's actually a very high rate, but it's a little hard to interpret when the numbers, we call them the denominators, the number of people is small, but absolutely we can try and produce that information. And it exists in our data.
And Dylan, there are two more questions in the chat, one from Katrina Fuller and another from Magdalena.
I see them. Also, hi, Katrina. It's good to see you. I really appreciate the work you do in our community. It's true for all of you. You asked about data on suicide attempt and loss survivors. I haven't worked with data on suicide attempt or loss survivors, but we probably should be figuring out how to do better at that. The ways that we might think about that is like adding an optional module to our adult survey, asking if someone, if a person is a suicide loss survivor. And then we would know more about the health of those people. We have not done that in the past, but it really might be something important to consider in the future, and I think is a really good idea. I imagine there's some academic researchers at universities who explore that question, but I don't have the data on hand. I see Sonia's question about if we could share the PDF about parent mental health. Once I stop sharing my slides, I'll go find the link and put it in the chat.
That'd be wonderful. Thank you, Dylan. And I also just want to, it's more of a comment as far as how this data is being used in Roswell. We work sorry, this is Magdalena Sonia Saiz, the behavioral health manager with Safe and Healthy Schools, New Mexico PED. We run a Project Aware program through 3 of our LEAs, and Roswell is one of them. And one of their report outs recently is that they used this data and the reports that you've produced with students to facilitate like discussion and have them ask questions just as you're asking us, Dylan. So I just think that that's such a powerful way to really involve young people in looking at what they are telling us, right? And then from there, they just didn't look at it and analyze it. Then they came up with some goals that they want to work towards so that they can, do something about what they're seeing. So anyway, I just wanted to share that out and thank you for your work with all of this data and the YRRS, Dylan. It's so relevant and important. So thank you.
Right back at you, Sonia. You've been doing relentless work on this topic. And yeah, there's that. I mean, I think the best thing that in my role as an epidemiologist at MDOH, the best thing I get to be a part of is just giving data back to the people who are affected by it. And it has seemed that people really appreciate it. And I've learned more talking to people than I have looking at the data. And there's some cool things going on. The Office of School and Adolescent Health is using some of our results about these topics to do focus groups with young people this next year as part of their evaluation process. And I think just like bring information back to people who make decisions about prevention, about like how young people see these issues and what they're looking for from adults. So there's just so much opportunity for this. I think a lot of people use their data too to talk to community members who are uncomfortable with topics of suicide or other issues and just want to avoid them. For understandable reasons, it's normal for people to be uncomfortable with these, but a lot of times we can just talk about it in neutral ways, and really tell people that like in their community, there's a number of people affected by this issue. And I remember sharing data back with a school that participated in a survey, and the principal felt like they had a duty to act. After seeing our data, they had shared that they do fire drills every year, but they've never had a child die from a fire, but they had lost kids to suicide. And then when they were looking at this data and thinking about it, they were wondering why they weren't doing things in the same level they do for fire prevention as they do for suicide prevention. So lots of good opportunities. And I'm going to look to Paul and Carolyn to cut me off. I don't know if there are any other just general questions or comments that you have. I'm obviously free, but I want to pass it back to you all when you're ready. And I might move just to a slide with my contact information so that you can reach out to me. And this is the teaser of things that we could look at, topics like adverse childhood experiences, relationship to drugs. I'll pause here for a moment. We put out a report last year on comorbid substance use and mental health issues. This talks about things like the relationship of suicide attempts and what drugs young people and adults are using. I'll just put the links in the chat too after we finish so that you don't have to freak out to get these. We have new data on social determinants of health. New Mexico has among the highest prevalence of lonely adults in the country. And thinking about what it means to be lonely and to have social connection may also be a factor in how our state might plan around suicide prevention. CDC, as of a few months ago, was planning a framework for mental health prevention, which was a new and exciting thing. I hope that this continues, and we may see more of that. We issued a report a couple of years ago now. A new report has a draft, but hasn't been published yet on state of mental health generally. This is a good report to see what kind of data we might have answers on. And if you see something in here that you want more recent data on, you can just reach out and we'll produce that for you. This is where you are right now, but encourage other people to join it. This is a great community. And I'll stop here and then lean on Paul, Carolyn, anyone else to cut me off and move on if you're ready.
Dylan, this is Carolyn again. We've got another question in the chat about the data collected on adolescents in high school. 1, do all high schools in New Mexico participate? 2, what screening tool is used for adolescents?
These are great questions. These are, I want to ask that, if you're ever another one, to ask that one again, because it tees up good information for people. So the YRS, the Youth Risk and Resiliency Survey, is part of the CDC's Youth Risk Behavior Surveillance System. The goal is to have all New Mexico public high school students and charter school students have a non-zero chance of participating, but it uses a random sampling design. So what we do is we run some statistics software to draw a selection of schools across the state that become part of our sample frame. And then we contact all those schools and try and get them to participate. And our goal is to get 70% of the students that we selected in our random sample to participate, because the scientists who work on statistics believe once you achieve that there's a really high degree of reliability and that those kids actually represent the entire state. In New Mexico in 2023 was about 60% of students that we selected actually responded. And we sampled about 37,000 students in New Mexico. Our design goes a little bit beyond what the CDC asks for. The CDC wants to make statewide estimates, but we survey so that we can make estimates at the school district level. And we try and do that for every school district in New Mexico. As far as screening tools, we asked the PHQ-2 and the GAD-2, which is a Patient Health Questionnaire 2 and Generalized Anxiety Screening Tool 2. There are two question instruments that have pretty good reliability for predicting depression or anxiety. They're not as good as the PHQ-9, but PHQ-9 is 9 questions, and these are general health surveys that ask kids about all sorts of health topics. So we're actually really lucky we got 4 questions on the survey. I don't think we'd be able to get the full 14 questions or so on them. I see Wendy's got her hand up, and then Rocky. Go ahead, Wendy.
Thank you, Dylan. Thank you, Dylan. What great information. We always appreciate when you have the opportunity to share data with us. So the YRRS, ooh, that's a tongue twister, is a great resource. And I'm just thinking out loud, that's not capturing all of our potential youth and young adults. And so I'm curious if there's ever been any conversations about maybe adding these questions into our EPSTAT screening, our annual health appointments that our youth have, in order to kind of maybe get the opportunity to connect them with resources in the moment rather than just collecting data.
That is an amazing question. So first of all, one thing that I'm concerned about with 2023 high school data, middle school data, is we have good data that represents kids who are attending high school and middle school. There have been some issues with attendance in a lot of our schools in recent years. And so it's kids who are not attending school are not represented in these surveys. And so these surveys don't really tell the story of all kids in New Mexico. And we should be thinking about who's missing also, to your point. I don't work with EPSTAT data or with the EPSTAT program. I did see people from HCA on the phone call, but I agree that a thing people might consider when looking at this data is, if we know these issues are so common, how can we get screening and early intervention and detection in there? And I don't know the current state of the EPSTAT screens and the guidance on the follow-up, but if that isn't part of it, that seems like a good question to explore. Dr. Romero, do you want to go ahead?
Yeah, thank you, Dylan. I just wanted to recognize the efforts that you all have put out there with regard to, I currently work for the National Latino Behavioral Health Association, and we are funded by SAMHSA, the Strategic Prevention Framework, and through our epidemiologist, Michael Coop, who does contract work with us, we were able to work with the Office of Epidemiology and YRRS to get a couple of our data points included in that, and we are seeing significant changes. Currently, we implement the Strategic Prevention Framework through our Families Moving Forward curriculum, and it's a 10 to 12 session prevention curriculum that we implement within Powaka Middle School and Carlos V. Hill Middle School, actually starting today on our cohort at Carlos V. Hill Middle School. But with some of our initial findings, we are also seeing decreases in some of the areas you noted, but also with that, we're also seeing increases in kiddos feeling more susceptible to violence and maybe even being threatened with violence in different ways. So, just kind of looking out and teasing out those details, I think just fits in with kind of the direction we're headed. And, of course, for any folks out there on the call today, if you're interested in looking at an evidence-based model that specifically is targeting substance misuse, but we're starting to fold in, obviously, the suicide prevention aspects of this work through our psychoeducation, Families Moving Forward curriculum, we would love to talk to you and see how we could possibly replicate that in different parts of the state as well. But we are seeing some impacts, and again, just wanted to recognize your office and obviously the work that you all are doing. So thank you again.
Thank you. And thank you for providing those resources and connection, and also for adding to the epidemiological work going on this. One thing that's to comment on safety and violence, New Mexico didn't High school data, we didn't see a decrease in bullying or fighting, and at the national level, a lot of the violence measures increased in 2023. I believe in our middle school data, we did see some increases in bullying. We also changed our question about bringing weapons to school in 2023 to ask if young people brought a firearm to school in 2023. The kids who brought firearms to school, it's less than 1% of kids, but they were way more likely to also have suicide ideation or suicide attempts. And thinking about suicide prevention as also a potential form of like firearm violence prevention in schools, there seems to be a growing body of evidence that suggests that there's a real connection among these young people who do some form of firearm violence, that they also may also be at high risk of suicide, or that they are sometimes even engaging in a suicide attempt when they do that. But we're seeing that in our data there as well. I saw a question about, or maybe I lost it. I thought there was one. Oh. If I missed something, let me know. But if not, I'll pass it back to you all.
Any more questions? All right. Well, hearing none. Dylan, that was amazing. Thank you so much for your energy and your expertise and your efforts. We so appreciate you. Thank you.
Thank you, everyone. You're my favorite people. Keep doing what you're doing. Appreciate it.
Thanks. Do we want to take a break?
This is Paul. I would say let's just do a quick 5-minute bio break and let everybody refill their coffee. We've got some coalition business to go over and some work groups to connect with and some announcements. So a lot of good stuff coming up, but we'll try and get you out here on time. So it's 11:14, so I'd say 11:20. Let's be back and online, and we will finish up strong. And thanks again, Dylan. Amazing presentation as always. I think this is probably the 10th or so presentation I've sat in with you, and you are amazing. So thank you for your time and your dedication. So see you all in about 5 minutes. All right, everybody, this is Paul again. Welcome back. I appreciate everybody sticking with us. As I mentioned, Dylan does an amazing presentation for us with some great data. We do have a few things to on the agenda about some coalition business. Carolyn, I'm going to turn the first bullet point over to you regarding the meeting topics, or maybe Clary. You guys had suggested a few meeting topics for the upcoming year. So I'll turn that bullet point over to you.
Thank you, Paul. So I do believe that our upcoming meetings, some of the topics that we'll be touching on is going to be the strategic plan, our 10-year strategic plan, and Clary will be talking about that. Also, Clary will be addressing QPR. So we've got that coming up. And then what we would like to do in October is have all of the work groups talk about what their goals are that will be coming up for the next year, and what they see for the future. So that's our lineup for the year. So I hope that you'll all join us for those. Thanks.
Okay, thanks. This is Paul. Thanks, Carolyn, for that. So I'm just going to just a quick mention of this, but once we get into the work group, we'll get into this a little bit more. But next month, we've got 2 legislative advocacy training days on the 11th and the 12th. I know Clary has sent out some details and invitations to register for that. Again, I'll wait for the details, and either Wendy or Corey can provide that. I wanted to give a quick update. Carolyn and I and a few others met with Riverside County Suicide Prevention Coalition in California about a month or so ago. I had an experience with them. I did some training for one of their coalition meetings and was very impressed with their organization. And so I wanted to give just a quick rundown of some of the things that we talked about. Interestingly enough, their coalition is very, very similar to ours, although they are funded differently, and they are through a county organization versus a state organization. But they are facing some of the same challenges that we are, which is fine. But they are funded by a state tax that's based on population density, that's meant for mental health initiatives. And when their work groups are formulated in a little bit different way than ours, but their work groups come up with initiatives and programs. They submit a request through their leadership, and then they have a committee that kind of vets them. They do produce a quarterly newsletter, which I think is an amazing idea, and I would love to adopt that. And then they have one day where they do a one-day conference in lieu of their quarterly meeting, which I think is also a great idea and something that we might look to the future. Some of their successes is they've done mental health ambassadors for gun shops, which I think is an amazing idea. They've done information, post-vention information packets with grief support resources, and then they've increased their communications and messaging through governments and schools. So just something to think about. Some of those ideas are awesome. They did send us a copy of their strategic plan. I think I sent it to Clary, but if I didn't, I will do that. because it's always good to get ideas from others. So I just wanted to kind of give that a quick update. Wendy, I see you have your hand up. Did you have a question about that? Okay, maybe not. Next, Clary, do you want to go on the next bullet point for the idea about the Mother and Father's Day?
Sure. Thank you, Paul. This is Clary. Um, we're constantly trying to think of new ways for community involvement and raising awareness, and reducing stigma across the state. So there's a great thing that has been happening in Hobbs, thanks to Katrina and her team. But I think it would be great to have it across the state. So on Mother's Day and on Father's Day, having a get together community group, whatever we want to call it, with lost survivors of suicide. So children that had lost a mom or a dad, moms and dads that had lost their children to suicide, they'd all be able to come together, be recognized. Those are really hard days for suicide loss survivors. And it would really give the community an opportunity to lean into them also. We know there's so much stigma around suicide loss that families aren't always supported the way that they should be. And this is a really great opportunity for the communities to show them that support, for them to be able to get together and heal. And if you are interested in having this in your area, in your community, we would love to support that. And if it could happen this year, that's great. If you'd like to learn more and maybe do it next year, that's wonderful too. And this isn't a thing that would cost lots of money. It's not going to be some kind of conference. I mean, some places it can be burgers on the barbecue, some place that might be pizzas, whatever works for each community. But we are happy to support that. And so reach out to us, put a note in the chat. And as we start to meet about these, I'll be sure to invite you. And thank you each for everything you do in New Mexico. Thanks, Paul.
This is Paul. I think that is an amazing idea. Clary had proposed it, and I think that's a great thing for us to do for community outreach. I did want to also kind of do a quick mention that you will notice that we have kind of moved to the Teams platform. I failed to mention that initially. We did this because it's an economic decision. We don't have to pay for anything because this is what the Department of Health uses. So I hope you stick with us. I know it's not everybody's preferred, but it does meet all of the criteria for us, and I do appreciate DOH for lending us that platform. Lastly, we are going to get into the work group facilitators, quick updates, but we do have quite a few work groups that need some help in moving forward. I've been trying to attend, as many of the work group meetings as I am able to, and I know Carolyn has reached out as well. And some of the work groups are doing amazing things. And they've got a lot of momentum going, and they've got a lot of participation. We would like to see that in other areas. So with that said, is there, and I think that the faith communities, I don't think that Jody is on, but I know that that Desiree was teaching a class today, so she wasn't able to attend. So Jody, are you on? I want to go through the menu of who's here. If you're on, just go ahead and speak up. Justin Nutt from the first responder group. I know, Justin, you had, if you're on, if you had an update on what's going on in your community in Clovis. Justin, are you around? Okay, I don't.
This was Nat. I raised my hand and I'll because I don't want to go too far back. I wanted to thank Clary for the idea of Mother's Day, Father's Day regional community. And Clary, you can reach out to me. I can take phone calls. I do have captioning on my phone. But something that would be cool to add to that is if a child or a teen or even an adult would like to know how to speak to their parent if they're worried about their parent having suicidal ideations. And that's sometimes a tough conversation because it turns out, don't tell me what to do. But I think that it's a two-way street, and reach out to me. I'd love to talk about that. Thank you.
This is Clary. Thank you, Nat. That's great.
Okay, awesome. Back to me. This is Paul. Corey or Wendy, do you guys want to talk about the legislative advocacy days? Because I know you guys have those days coming up.
Yeah, I can talk about it. Can you hear me?
Yeah, we can hear you, Corey. Go ahead.
Okay, sorry. My apologies. And my house is a little crazy today, so I'm not going to put my camera on. But yeah, so we're super excited. For anybody that's not familiar, last year we hosted the first dedicated suicide prevention day at the Capitol. This year we're doing the same thing again. It's going to be on February 12th this year. It's called Advocacy Action Day. And it's in partnership with AFSP, so the organization that I work for. It will be on February 12th from 8 to 2. There's stuff going on throughout the day. We have hopefully advocates that will be coming, and we will give them the information if they would like to meet with legislators. There'll be a press conference. And we have a whole slate of people expected to speak. And then we have a bunch of agencies that are going to be tabling with various suicide prevention information. So we're really, really excited. We would love to have as much representation from the coalition as possible. There are some training days before. So there's the day before in Albuquerque, there's actually a training option. It is, and thank you to Fran Romero for helping us get that set up. It is from 10 to 3:30, and we have a really great slate of presenters for that as well. Learning about the different data, learning about how legislation works, what legislation we're supporting. We'll be doing our Talk Saves Lives presentation. So it's a really great opportunity to kind of get some knowledge and training before you go into those meetings, especially if you're wanting to meet the day before. And then if you're not able to make the in-person pre-event training, we'll have like a much more condensed version on February 10th in the evening. But in general, we would just love as many people as possible to attend on the 12th in Santa Fe at the Capitol. It's free to attend. And last year was just such an amazing event and we're just so excited for this year because we feel like we have a lot of really great momentum. So I put the link to register for the event in the chat. And then I believe Carolyn already sent it out as well. Just a note on that. There is like the button on the kind of the top of the page. It says register. That will register you for the event on the 12th. But if you scroll down on that registration page, you'll see they're a little bit more hidden, but the links for the training dates. So the Advocacy Action Day itself is on February 12th. And then and it's from 8 to 2, and you don't have to be there the whole time. But there will be kind of stuff going on throughout the day. So from 8 to 2, and then the training, like we're calling them pre-event learning days. The in-person option in Albuquerque is February 11th from 10 to 3:30. And then the virtual option is February 10th from 5:30 to 7. Any questions on any of that? Oh, and if you are in, working with an agency or in any of the other work groups and you know of some legislation that's specifically suicide prevention related or mental health related, please let us know. We have a really great policy team that's helping us out of DC that works with all the states on their state legislation. So we always like to send all of the things to them, and they help us really put together the list of policy that we'll be supporting for the year. And thank you, Sam. Sam just put the information for the training days and stuff in the uh in the chat. But please make sure you register for those, because we have to RSVP for the in-person, especially training option, and for the virtual one too. If you want the Zoom info, we have to RSVP for like food and stuff.
All right, this is Wendy. Thank you so much for sharing the updates on our upcoming events. I just want to add one small plug. I've had some people reach out to us to ask for tables, and I just want you to know that we did try to pre-plan as much as possible to ensure that this was going to be a spectacular event for you all. And so all of our tables have already been identified by agencies. And so if you are an agency that's looking to have a table, I'm more than happy to see if I can partner you with somebody else that might be willing to share their table space. But at this time, all 24 of our tables have already been identified by providers and community coalitions.
Okay, this is Paul. Thanks, Wendy and Corey, for the amazing work that you guys are doing in getting this done. I would like to plug that the most amazing thing that I saw when you guys were planning this is that I think last year you had a quarter of the rotunda for this event, and this year you have the entire thing. And so that really shows that you guys are working hard to make sure that we have a presence at the Roundhouse for this year. I also want to mention that Nat had stated that House Bill 4 might be something that you guys look at. I don't know the details of it. She mentioned it when we were talking prior to the start of the meeting, so that just may be something that you put on your list. So thanks again for all of that information. I did see Regina from the schools group. Regina, did you want to give a quick update on what's going on with the schools and youth serving group?
Good morning. Yes, this is Regina Bejarano with the Youth and Schools Work Group. I was trying to figure out how to summarize what we've been doing, but I will tell you that we do have a really committed group that meets monthly, every single month, the second Wednesday of the month at 3 o'clock. If you're interested in being on that, attending and getting that link, you can put that in the chat and I can send you the link for that. But Maureen and I have been trying to lead the group. It's not really our group, it's the group. And so we have a lot of dedicated members who are working on resources and services and how we can best support youth throughout New Mexico and to help reduce suicide. So we do have the focus of youth in schools. We've had some great presentations on resources such as 988. Dylan's done some presentations. We've just had a lot of different resources, Yellow Ribbon, and so on. So it's a great place to connect, to get info, to send out info if you need to get info out to anybody else, and just really do some resource sharing.
Awesome. Thanks very much, Regina. I appreciate it. This is Paul again. And again, attending those meetings, they're amazing. A lot of hardworking folks that are similarly focused, and so thanks for that. I also saw Valentina on. I don't know if she's still on. Valentina, do you have an update on the veterans group?
Hi, can you hear me?
Awesome.
Hello?
Thanks. Yes,
Oh,
I can hear you.
Okay, great. Hi, everyone. Let's see. So for the veterans, we have a couple of updates. One is that the Together with Veterans VA funded program is still up and running in Taos County. Their funding does run out in March, and so they're looking for other funding opportunities. So if anyone on this chat or anyone on this in this meeting has any opportunities for suicide prevention grants for the veteran community, please reach out to me. Addition to that, there is still a Together with Veterans program in Roswell and in Farmington. They still have 2 years left of funding, all of which are doing really well. They are the first 3 years, of course, is like the planning and strategic planning phases for the program to, of course, make it a program of record or even so have long-term funding within the community to prevent suicide and have capacity building within the community. So those are the three updates with Together with Veterans. Addition to that, there is QPR training being conducted in all 3 locations through the Together with Veterans program. The QPR training is free, but we are looking at exploring different trainings. So like the assist training, I hear has better outcomes and it's more evidence-based, which is QPR. And so we're trying to see if we can explore that. Again, our lack is funding for that sort of funding or for that sort of training. And other than that, the VA had just released their data sheet. I did share it with Paul. He should have that, and I believe he can push it out to everyone who wants to see the VA suicide data that was released for 2023. Other than that, that is basically it. Or actually, there's one more thing. There is the Governors and Mayors Challenge that is going on every other month. And so they meet and they have their initiatives as well. That's run by Thomas Tozier and I forget the chair, the main chair, but they meet next month. And so if you guys are interested in joining those meetings or even our meetings, please, again, reach out to me. We're always looking for partners and to work collaboratively with every working group here. That is all I have, Paul. Thank you.
Thank you, Valentina. This is Paul again. I would also like to mention that they shared a recent report about military and veteran suicide, and I'll make sure and share that with Carolyn and Clary, and they can get that out to the group. It's also got some very, very good information, similar to what Dylan did, but military based. So do appreciate that, Valentina. You guys are doing some great work as well. I think that's all the groups that I saw represented. Is there anybody on the call that is working with some of the work groups that want to give a quick update? I'll kind of open that up.
This is Liza. On the agenda, it says Teresa Yazzie with the Native American Indian. And Teresa, you look like you're in the meeting. Can you hear us? You want to speak up?
I am in the meeting, but this is the first time I'm attending again since last year. So yeah, I don't know what happened. I was not added on to the listserv, I guess. So when I went to the meeting last month, I got added back on.
Hello, this is Tony Quintana. I'm with the Albuquerque Area Indian Health Board. And so I just wanted to share. So our group has been working with the Honoring Native Life group at UNM to revamp that work group, actually. And so we had a meeting last year in July to update the strategic plan that the group had created in 2022. And then we just met a few days ago to kind of revisit that. We did some action planning to get some action items going, and just trying to really get it restarted. So Teresa, I'd like to connect with you and get you back into the fold. And one thing we're looking at is, who else do we need to reach out to get back into that work group? But we are working to build momentum and getting some initiatives going. So yeah, hopefully we'll have a really more robust report at the next quarterly meeting.
Awesome. This is Paul again. Thanks, Tony. I'm really happy that you're able to kind of get things going again, and that's really kind of what we need to do in some of the work groups. I would like to kind of go backwards a little bit. I was involved in the first responder group before I took over as the chair-elect and then the chair. And I'm still doing some work with a grant that we received in doing education for rural fire and EMS departments. And I will say that we just had a great meeting with Cuesta in that area. They recently experienced a loss, and they're interested in kind of reaching out to their community as well. And we've got a couple others that are on the schedule. So we're continuing to work for that. And having said that, Dylan's presentation did show a pretty significant group that is affected by suicide, and that's the construction industries. And I know that there's been some talk among the coalition about getting a construction industries work group. I know some people who are in the construction business. I don't know if they have a passion for this. I would just put this out to the group that if there's anybody that they know of that's in the construction industry, or maybe in a support group for the construction industry that is interested in trying to start that work group, I think that would be very, very effective and something that might be needed by that industry. So is there any other work group updates that need to be mentioned at all?
This is Clary. I wanted to add that I've been talking to American General Contractors. They have a conference coming up in September, and we're just talking about how we can support them and what all is involved. And they're also looking at putting up monthly QPRs, having visits on the site. So they really are, I don't know if we'd say proactive at this point, but they're very interested in having more information.
Thanks, Clary. This is Paul again. If they're willing to have us, either do a table or do a short presentation at their conference, please let me know. I'd be interested in getting some folks together for that. So that might be a really good. And it looks like Corey said that AFSP is looking to do something in the construction industry as well, and she'll keep us updated. So that's awesome. That's great news.
Awesome.
I would like to, Kate, are you still on the call? I saw you earlier.
I am. I'm right here. This is Kate.
Hi, Kate. Do you want to say hi and give any quick updates that you have?
Yeah, well, I don't have any updates. I think we had shared during the last coalition meeting that I was going to step in and support Paul with the chair-elect. I do believe that position is still open. If there's anybody that wants to nominate anyone, I am absolutely fine in this role for now and supporting the coalition. But I think that's all I have. Today was great. full agenda packed with a lot of good stuff. I'm always just amazed when we come together every quarter to see how many people are attending this. It's really nice to see. I think we might have lost Paul.
I just added him back in. I hope he can join us again. I don't see him back here.
Oh, well, Carolyn, I'm more than happy to carry the rest of the agenda out. What do we got on the agenda?
Okay, so that we're just doing the wrap up, our next date, and then adjournment.
All right. When is do you mind sharing? Oh, that okay.
Yes. So our next coalition meeting will be Friday, April the 25th, and it will be from 10 a.m. until 12 noon. Everyone is invited, plus some.
Excellent. Looks like we had some hands come up, so maybe we can go ahead and take those.
This is Liza. I think we skipped over the coalition member announcements and resource share. That's probably what the hands are.
Good catch, Liza. All right, so that might be why the hands are up. So do we have some things that that our members want to share? Please just go ahead and share those.
Hi everyone, my name's Claire Carmody and I'm from New Mexico Crisis and Access Line, so we answer all the 988 calls. And Rosella, who's on the call as well, Rosella and I put together an infographic. We did it for some of our state partners, but I thought it might be interesting for you all to see. So I'm going to drop it in the chat, but it just gives some highlights of this year in review and also how things have changed in crisis calls since the rollout of 988. So feel free to share with your networks and let us know if you have any questions.
Also, just real piggyback off of Claire, if there's anything that you need in addition to the infographic that we just shared, please don't hesitate to reach out. We can share some of our data. And if you visit our website, we also have all of our reports uploaded on our website, and I'll dump that into the chat as well.
And I'm seeing that Nat isn't able to access, so maybe what I'll do is I can email to you all and then you can share it out. Does that work?
I have a copy, Claire, and I can get that to Carolyn to be sent out.
Thank you so much.
All right, this is Katie again. Thank you for sharing that. Anyone else want to share any updates or resources with the group?
Hi, I wanted to just share. My name is Gail Porter. I own New Mexico Crisis Counseling. Just wanted to let everyone know that I have a contract with the Department of Veterans Services to offer suicide-specific treatment to veterans, service members, and their families statewide via telehealth. Suicide-specific treatment is part of the National Strategic Plan and also part of the Veterans Strategic Plan. Really excited that DVS is one of the first departments in the state to support this kind of treatment for people. We fill that little gap after a crisis. So after 988, after being discharged from the hospital during that very critical time where people are at very high risk of dying by suicide. A lot of times it's the little bridge before getting into long-term treatment. We try to eliminate the wait list by providing this very specific targeted therapy. So we are out there. So if you have people that need those services, send them our direction. We're also credentialed with TRICARE and TriWest now. So being able to help some of those military folks is our passion.
Just a quick, oh, I'm so sorry. This is Carolyn. And just to let you know that our next meeting, Clary Miller will be doing QPR training. So I hope that you all join us then.
Thank you. This is Kate. Thank you. Valentina?
Hey, Gail. Gailey Porter. This is Valentina. I would love to connect with you. I will put my email in the chat. Please reach out to me, and I would love to collaborate further. Thanks.
All right, this is Kate again. Is there anyone else who would like to share any updates or resources, information, or other? Nat.
This is Nat. Thank you, Catherine. Will there be little bags or goodie bags prepared and then placed on the desks of all of the senators and all of the representatives with information about suicide prevention 988 and so on? Several legislators during the interim mentioned that they hadn't seen much of the swag that's available. And those goodie bags, lots of people put out the goodie bags, but there are a couple in particular that if those goodie bags are available and you are not able to place them on the desks of representatives and senators on the chamber floor, I would be more than happy to pick a few of those up and give them to the individuals who mentioned that they were not aware of or had not seen the circular 988 logo with the turquoise and the yellow. And, if they miss it, we want them to have it so that they don't miss it and can provide it to their constituents. Thank you.
This is Kate again. Thank you, Nat. Valentina, your hand is up. Was that from before?
Yeah, that was from before.
All right, great. Anyone else have anything they want to share? No? All right, well, we're just about at 12 o'clock. Carolyn, Clary, Liza, if you guys don't have anything additional to share, I think we can probably step off a few minutes early. I do want to thank you, Carolyn and Clary and Liza, for being here to support the coalition as much as you do. It's a great help. And we will all see each other back at our next quarterly meeting. Thank you, everybody. Take care.
Kate, thanks so much. Bye-bye, everyone.
Bye.
Bye-bye.
Bye, everyone.